And as such, we have one more profound personality to introduce to all of you. He is a community health physician with global health expertise. He has authored 2 books, has 19 research publications, spearheaded 17 public policy advocacies that impacts over 2 million people, and he has written over 160 articles in print and electronic media. He was the US State Department Legislative Fellow in 2017 and the only doctor from India to be selected in 2017 in the US. He's also the Urban Health Collaborative Visiting Scholar at Drexel University in Philadelphia, and he's also a member of the Health Task Force DDMA, Government of Karnataka. Wow, so many accomplishments to someone's name. He is a legend. Please put your hands together in welcoming Dr. Edmond Fernandes to the stage. Hi, sir. Very, very much welcome to you, and thank you for joining us today.
Thanks, Anne, for the introduction, and a very good morning to you.
Thank you. So, welcome to Ashraya. You, doctor, you seem to be a force of nature. You are a physician, an author, you are a US State Department Legislative Fellow, and you are also a writer for the Times of India. The list goes on and on. Can you tell the audience a little bit about what has thus far been your most fulfilling achievement?
I think all that you just narrated is decorations that you get for climbing the ladder.
Mhm.
But I think the most by far achievement right now, what I can think of, is adding smiles on the face of those who have none left to offer.
True, true, very, very much, sir. And as a frontline worker, that's your job, and we could not be more thankful for all the work that you do. Thank you. We have had a very tumultuous year since the beginning of 2020. Every country has been coping very differently with the ongoing pandemic. There are COVID mandates, there are resources, etc. And one of the largest cities in the world, New York, was shut down for almost 6 months. And now, when the US is finally opening back up and running, India is hit with the worst wave since Italy. As a doctor with a foot in both the US and India, what did you notice were the most startling differences in the way that both countries handled this pandemic? Why and what do you think could have been done better?
I think both countries are huge countries, and unlike what the media compares with different smaller nations, these are complex democracies. While US is called the United States of America, I think India also deserves the United States of India.
True.
And having said that, both countries have nationalistic governments. You can look at nationalism from different perspectives, but notwithstanding, hyper nationalism becomes a bit concerning. And that's where I think we got carried away with the kind of confidence we had in ourselves, and also with the kind of efforts we made to control the first wave. So that callousness and that laxity in terms of, yes, we managed the first wave, the second will also be managed, put us on the back seat. And the second wave taught lessons for not just India, but also rest of the world, that we haven't defeated the virus. And let us not be overconfident in terms of how do we control the virus. And a one size fits all approach was not going to help. So this is where, while India had a big hit, it's lessons for us to prepare for the third wave, and at the same time, lessons for rest of the world to vaccinate, to test, treat, trace, and at the same time to be on your vanguard.
Absolutely, sir. Very well said. Test, treat, and trace. Three T's. Being a frontline worker on any given day is difficult, let alone during a global pandemic. You are witnessing mounting deaths in six figures all over the world, and you're trying your best to stop it. How do you keep yourself sane and hopeful during this time? People all over the world are undergoing severe mental health problems due to isolation, passing of a loved one, being laid off, and for our SJC first year students, especially, not being able to see your friends or enjoy a normal college life. And, the list goes on and on. What tips or guidance do you have for everyone on how to deal with anxiety and cope with depression during this time?
I think this is a strange time in the world where everyone is going through lockdowns, social isolation, and work from home. My advice to all of us is make the maximum of what you can get of this opportunity, because you will never get this opportunity again in your lifetime. Even if you go back historically to understand how pandemics work or have been in the past, it's usually once in a century that we will see this kind of pandemics. I am not saying we haven't seen different kinds of endemics in different pockets of the world, including Ebola, Nipah virus, Zika virus. But the nature of this pandemic, a global lockdown, is only going to be as much as it can last. So make the most of what you can do. Indulge in reading, indulge in binge watching, indulge in talking to friends you've not caught up in a long time. Don't regret later saying that, oh, I never had time, because this is the best time you will ever get again.
Thank you, sir. Definitely, definitely correct. Maybe in some ways, you can say that if there is a silver lining, that is that it gives you a lot of time in your hands. You have time, like you said, to cultivate a new habit, reading, surfing, doing whatever it is that you never had time for before, including spending time with your family and friends. So, well, very well noted, sir. Thank you so much. So masks have become such a quintessential part of our livelihood now. In the US, mask mandates in public places have been lifted, but although private places and public transportation you still require it. In India, I see masks to continue being used for the foreseeable future because the vaccines are still just coming in. We are still just experiencing the second wave. What do you see, if from your perspective, forever changing in our lives post this pandemic in terms of health, social etiquettes, changes to healthcare policies, etc.? What do you see will be some new changes that we can look forward to?
So, firstly, we would not take US as a benchmark for policy making for rest of the world. Currently, this moment and coming centuries belongs to Asia. You can say India, you can say China, you can say whichever nation you want. And in terms of wearing mask, it might be new to India, but if you ever cross the stations and subways of Tokyo, you cross the bylanes of Taipei or Shanghai or Hong Kong, wearing mask in public places to protect yourself from infectious disease, to safeguard yourself from dust, allergies, pollutants, has been a way of life. So I am least interested in what wisdom Dr. Anthony Fauci would give to rest of the world, because different countries have different geopolitics, different complexities, and a one size fits all would not help. While I understand that mask wearing of mask has been lifted from US, let's also understand that Americans' graves or even bodies that have been lying in New York hospitals have not yet been cleared. I'm sorry for some housekeeping issues right now, but unable to
That's
help on
perfectly
that.
fine.
Yeah, so I think wearing of mask from a safety perspective, from prevention of allergy, and also from dust would go a long way as a social practice for
True.
boosting immunity and also for sustainable healthcare.
Absolutely, sir. So, the SJC COVID Care Center is one of the many million initiatives by colleges, youth centers, communities, etc., in India to support very hard hitting communities. They provide food kits for families, they issue health care equipments, supply masks, and they assist with vaccination drives. What is your message to all of these care centers across India?
Uh, my message would be don't do anything for people without involving what they really want. Why am I telling you this? I'll give you a simple example without naming the nation. It was hit by a bad earthquake. There were piles and piles of dead bodies around. But when aid and relief agencies came in, they started bringing food, they started bringing water, they started bringing number of things. But the local communities on the ground wanted just white bed sheets to cover the dead. And then we had other countries sending, uh, what do you say, tinned and packed food in different languages without really being mindful of the cultural sensitivity of the place, the language of the place. And what happens in a lot of these cases is that aid agencies bring out the best and worst of human effort, but it doesn't really meet the requirements of the ground. So while I would like to congratulate Ashraya's efforts and the entire team behind all of this, I would request you to segregate the amount of funding you collected to strategically invest in communities and in places where the need is the most. Say, for example, in some corner of Bangalore or Mumbai or Delhi, you will find migrant laborers who are unable to meet 2 square meals a day. In another corner of a tier 2 or a tier 3 city or a village, you will find families not being able to access medicines. In another place, you will find somebody struggling to find an oxygen cylinder, but you will find them all with different needs. And that's where I would want the entire exercise and effort of different care centers being channelized in consensus with local requirements at where you are trying to reach that. What will happen in this process is you will have the satisfaction of having been contributing your might in kind or in cash, and at the same time you will see that very community or society or individuals or families benefiting from the same. And there can't be greater satisfaction than to see where donor funding and where beneficiary requirements meet.
Absolutely, sir. I think that's a very valuable tip that the COVID Care Center and everybody who's listening can take. Definitely donate, but make sure that you're meeting the requirements of the beneficiaries, like you said, sir. Last of all, there has been a lot of dissent and opposing views about the validity or the credibility of the vaccines. It came out too soon. It has lasting side effects. It's a way for the government to keep a track on us. There's a lot of speculation and controversies around it, and all of these speculations and dissent has led to thousands of people deciding that they do not want to take the vaccine. As a doctor, what do you have to say to the masses about the credibility of the vaccine and why it is crucial to it's a crucial step in attaining herd immunity?
So I'll give you a simple example out here. It's like if you're going to war, you will equip your army and soldiers with bulletproof jackets. This does not mean that that very soldier or your battalion of armies will not be hit by a bullet, will not be a victim to a sniper attack. The whole psychology of taking vaccine does not guarantee that you will not get COVID-19. It further doesn't guarantee that you will not die if the patient has comorbid conditions. What it does to thousands and thousands and millions of people is it builds a person's immunity. So, say for example, now I am vaccinated and God forbid I get COVID. Science or evidence tells us that the severity of the disease will be far, far lower than if I was not vaccinated. Now, each person's body is going to react differently to different things. And in such times, uncertainty remains the only certainty. So, my message to all of you in conclusion would be to wear a mask properly that covers your nose and mouth. Wash the mask if you wear it every day, and vaccinate yourself. You will be doing a big favor not just for yourself, but for your family members, for your circles and neighborhoods, and for the world at large. Don't listen to theories that come on your WhatsApp, on your Facebook, because these are all controlled by vested interests trying to promote alternative ways of making money. Use your common sense. I know you all are engineers, but I'm asking to use your common sense, that God gifted grandmother's common sense, which will take you far and which has also sustained you all till now.
Thank you so much, sir. It was a pleasure having you here. You've shared some really great tips with us, which I'm sure all of us will take back home with us. Thank you so much.
Pleasure, and I extend my congratulations to St. Joseph Engineering College management, the faculty, and the student community at large. And lastly, to you, Anne, for hosting this. All the
Thank you, sir.
best, and have a
Of course.
nice evening ahead.
You too. Thank you. Thank you so much, sir. A little bit about Dr. Edmond Fernandes and the organization that he heads. It's called CHD Group, which is a pan India public health organization working on different public health and convergent development themes with the Indian government, United Nations, and multinational corporations. The CHD Group is headquartered at Mangalore with a satellite office in Mumbai. It has been recommended by the Committee on NGOs for a special consultative status at the United Nations General Assembly at the UN headquarters. So, this is a great, great organization, and we hope that all of you will go ahead and proceed to check this group out on their Facebook, Twitter, and Instagram. You can find them at facebook.com/CHD Group Global, and their Twitter handle is at CHD Group Global, and their Instagram handle is also at CHD Group Global. So please, everyone, I hope you take this opportunity to look at this organization, study a little bit more about it, and find out how you can contribute.
Subscribe to our YouTube channel and press the bell icon to receive latest updates and stories.